I do have a question, Abir and maybe Dr. Abu Alpha. So let's say there's an NGO in any sort of setting that set up their own IRB. How do we make sure that they're actually adhering to the principles? Like, what if they're not? Is there a more of a global governing body that makes sure that different IRBs are actually adhering to those principles?
It depends. Honestly, part of it, they need to follow the law of the land. They need to follow the national law. So what does their law say about research ethics committee? And whether they need to be authorized as research ethics committees to review research, human subject research. There are bodies that give accreditation to IRBs, like the AHARP, but these are, it's in, this is in US, it's a regulatory body in the US. And they check whether the IRB is doing its work appropriately. Yeah, I think, I don't know if Dr. Abu Alpha, would you like to add anything?
Yeah, thanks, Abir. So the most important in the IRB accreditation or certification is depends on the setting you're in. Is it a stable setting? Is it a conflict setting? Is it a war setting? Is it a crisis setting? Is it a natural disaster setting? Because the need for research and collecting of data to help communities and human beings be better or survive a certain crisis will dictate a lot what to do. And so I think the most important is that there are the principles based on which IRBs are formed are upheld. And these principles will require that there is some independence, that there are some due process, that there are some documentation, and it goes from there. So the most important message is that the principles are accepted as universal and that they are the foundation for a research ethics committee or an IRB. And then from there, one can use a number of frameworks to, and some of them have been used, to pursue investigation that may be necessary while providing help or post-providing help, or to assess the need for help of what it is. And usually we're not talking about major clinical trials because those are a little bit different. The risks are usually of a different nature. And we can take when there is, let's say, an earthquake and there is a need to assess, it happened in Haiti. Would we assess the need? And if there are underage with parents not accounted for or unfortunately passed away in the crisis or in the disaster, how do you get consent from the minors? And all of these require some broadening of our approach and thinking about it, but the principle should not be compromised. It's not an excuse to forego the due process of safeguarding the rights and welfare of human subjects in anything we do, but then the framework dictates sometimes how to do it. I hope this helps very generally what I'm saying.
Thank you so much. Dr. Talia?
Yes, again, thank you. And thank you, Abir, Dr. Abu Alpha. I just want to add another aspect. In Lebanon, in particular, any research ethics committee or IRB, as they call it, has to get a permit to be a research ethics committee from the Ministry of Health. So we have a committee at the Ministry of Health. I happen to be a member of this committee. So we get all the research ethics committee proposals. We initially wanted the committee to be an accrediting committee, but then we opted not because it cannot do this at this point. So we did reject some research ethics committee proposals because it's not just about the protocol, as I'm sure my colleagues agree. It is about members, training, quorum, and all these details. So it has to go through the through the Ministry of Health. Another thing, there was also talk at the National Bioethics Committee level that maybe the NBC can be a central IRB to Lebanon. So far, this has not been approved. The discussion is ongoing also at the level of the WHO EMRO as to whether we can have national bioethics committees that can fill the gap when there is no clear IRB processes, if you wish. Thank you.
Absolutely. Thank
Thank you,
you so
Dr.
much,
Arawi.
Doctor. Okay, so thank you, Ms. Abir, for the talk again. So we will have, so just one thing, we'll have a break now for 10 minutes. Dr. Ghayas was actually able to join us, so he will give his talk that was scheduled yesterday. Dr. Ghayas' talk will be very pertinent. It's about ethics in emergency settings. So he will start his talk just right after the break, which will end at 10:20 Beirut time, which is around 9 minutes from now. Okay, thank you so much, and we will see you in 9 minutes. Okay, hello everyone. We are back from the break. So there is one question. I think this is for you, Dr. Talia. I'm not sure if you're with us. Dr. Talia, are you with us?
Yes, I'm here.
Yes. So one of the questions from Ludmila, she says that she's in Lebanon and they're currently in the process of setting their own IRB for their NGO. So that's why they're getting the contact or the link to approval permit of the MUH of an IRB. Is there a link for the approval committee at MOH, or how do they get the contact with them?
So thank you, Dr. Zahi. I already replied to our colleague Praxis. So it should go to a contact to the MOH, and when they send the email to the MOH, they will send a list of the required documents. Once we get the list of the required documents, the file is studied and we get back to them. That's it.
Perfect, perfect. Thank you so much. Thank you so much. So for the next session, we're gonna have 4 different talks, actually 3 different talks. Just so we don't mess up the schedule, we will keep it as it is. We will start with the ethical challenges in research dissemination by Ms. Jihan Saiso. Then we will switch to addressing common conflict ethical dilemmas by Dr. Anif. And then we will have the talk by Dr. Ghayas about ethics in conflict settings. And then we will switch to the discussions. So next we will have Ms. Jihan Saiso, who is the executive director of MSF in Lebanon. She joined MSF in 2008 and has worked in countries such as Afghanistan, Pakistan, Iraq, Ethiopia, and Belgium, primarily in communications and advocacy. Her talk will be about communications, specifically addressing ethical challenges in research dissemination. Jihan, the floor is yours. Are you with us?
Hi, everyone. Thank you, AUB, for having me and the Global Health Institute for this initiative. My presentation is going to focus on the implications and the topic of research dissemination. And I think I'd like to start first with this cartoon. So I don't know, due to the presentation issue, if you can see, but actually this is a researcher trying to look at his reflection in the academic mirror, and he can only see, so it's a researcher from probably the Global South. This is a project that is called the Bukavu Silent Voices series. So Bukavu is a province in Eastern Congo, and the researcher cannot see himself reflected in the academic mirror. He can only see his data reflected, implying that researchers that make possible this kind of research are not really valued or wanted or seen by academia, and only the research is taken. I really think that this is a consideration that is important, because it's not only linked to when the research is created, and you've been touching in this workshop on different elements of that, but this is actually a consideration even when it comes to dissemination. Where research happens versus where research gets shared and disseminated is still mostly defined on a south-north axis, where research in general still globally happens in the global south and gets disseminated in the global north. And when we're thinking about the ethics of dissemination, this is definitely something that we need to keep in mind. Academia is a mirror when it comes to research dissemination. And the global south is usually treated like an object of study instead of a site of knowledge production and expertise. And doing this like mental switch and reframing is an important part of kind of revisioning and reimagining dissemination strategies. So in the same way that we don't want to do any harm with our work, we also don't want to do any harm with our dissemination. So the main tenet is do no harm. But I'd really like you to walk away from this conversation really certain that research, when disseminated publicly, actually has a lot of power. It can influence, it can define, it can change narratives, and it can create a difference on the ground. This is why an organization like MSF is not just delivering healthcare in areas of conflict, epidemics, disasters, or exclusion from healthcare, as you know. We are also intimately involved in medical research and reflection, because for two reasons. The evaluation and operational research actually makes our projects better. Okay, so it's ultimately better for patients, they improve the effectiveness and quality of our work, but they are also tools for advocacy and change. And they can, even if we don't have answers to all the questions and the dilemmas that we face, we have a duty to put them out there. So putting research out there is a duty, even if there are dilemmas and risks associated with it, and we will be looking at some of those. This way of looking at research as a tool for advocacy and change, and not just an intellectual exercise whose main objective is publication and promotion, is really important. Another thing I'd like to highlight is that the conversation about dissemination is not something you come at the end once the research is done and everything has been completed. Actually, the conversation about dissemination can happen at the start and should happen at the start, even if the outcomes are not known. I'm going to share an example in a bit, but I also want to highlight that daring to ask powerful and difficult questions about communicating research findings might actually even lead to a change in your research and your methodology. So if you can keep anything away from this slide, is of course that you don't want to harm and you don't want to create any harm with your research. Neither to research participants, neither to communities, and we can look at a little bit at that later. But also the thinking about dissemination and having a mindset that is dissemination is open to dissemination is something that can even change your actual research, and it can even contribute to changing your methodology. In 2014, I was part of a team doing a qualitative research on the obstacles of access to healthcare for patients in Afghanistan. And at the time, when we were considering the dissemination of this research, we did the usual suspect things. We produced a policy paper, we produced a public communication campaign, we used a range of audio tools and video tools. But then what we couldn't really foresee at the time is that 4 or 5 years later, we would be contacted by a lawyer in Greece working on a case where this report, the public, so not the scientific articles which were produced and published in scientific journals that don't really have the kind of reach and engagement as within the general public as a public report would. And actually, the public report was used as a document in a courtroom to advocate against refoulement and against sending back the patient, the refugee, to Afghanistan, saying that this is a report that really looks at the difference between rhetoric and reality on the ground. And to be honest, when we were working on it, we had no idea that even a few years later, this report will still be useful and used to improve the situation of a person on the ground. So I think it's really important to think of dissemination as engagement and as praxis. So as a practice and as an action. It's not just about sitting there and defining a few theories, and it's not about having a dream checklist of publication outlets and considering the job done. It is really about trying to think of different audiences, different messages, of operationalizing that research and putting it out there. I started with a bit of a provocative slide that touches on elements of power and privilege. because inclusion is incredibly important as a topic, and it doesn't just begin and end when you think about including local researchers from the ground in your actual research. It's also important to have an inclusive approach, even when it comes to dissemination. Again, where are scientific journals launched? Or who are the audiences of these journals? What is the language used of these journals? These are all elements that need to be taken into consideration in this reframing of participants and communities as stakeholders. And again, coming back to this idea that the Global South is not just an object of study, is not just an object of research. It's a site of knowledge production and information. And this kind of reframing is super important, and it can help you identify the right audiences and the platforms, as well as choose the right tools. Now, when we think of the risks, because most of the time when I'm speaking about this topic, people really want to know the risks, and I really believe that we spend a lot of time looking at dilemmas versus looking at opportunities, and it can make us a little bit risk averse. There's no such thing as zero risk, and my colleague Anik, who's coming after me, will talk about it for sure. But in general, we tend to have a bit of a risk and negativity bias rather than an opportunity one when it comes to dissemination. Now, what are some of the risks? Oversimplifying and confusing words and summarizing even basically your research in the wrong way can mislead and can misinterpret, and even can put the organization that you're working with or the academic institution, it can jeopardize the credibility, both with the general audiences as well as the scientific audiences. But also for an operational organization like MSF, this credibility is also with patients and with communities. And we take that very seriously, as seriously as we take our credibility with the general public and with academic institutions. And that's why dissemination cannot be just a discussion about putting things out there. It needs to really be a holistic approach. And I'll come a little bit to share how, as MSF, we do that. How is the data that we provided going to be used later? Maybe this is one of the most popular questions that you get asked when you're carrying out the research. And this question gets asked really early on, even sometimes when we are not really sure how we're going to use the data. But it's really important to take this question into consideration, to be aware of it, and to realize that we are accountable to communities, and that specifically in this way where local researchers sometimes are seen as just implementers, where the decision makers are sitting somewhere else, this creates a complication for this question, because local researchers are sometimes just vessels of data instead of participants in the entire process. And I think earlier presentations in this workshop touched a little bit on the importance of working together and how you construct your research team and where do they come from, and how does that not reinstate issues of power and privilege. So it's really, really important that local researchers have an idea on what is going to happen with this data and how it's going to be communicated, even if things are not super clear at that stage. This accountability towards participant population is key, and it can mitigate against the local researchers losing trust. In the case of MSF, in many times we are carrying out research in areas where we already have projects. So any short-sightedness or confusion or miscommunication with patients, stakeholders, communities will lead to a high price for the project to pay. So it's something that can have consequences. Maybe if I want to be a bit, again, provocative, maybe these consequences are not super evident if a research team is going just to research and leave. But when the research is taking place in an operational setting where you have project continuity, the kind of acceptance and access that you have from population is something that you do not take for granted, and you cannot take for granted. So if the research process is an inclusive and a fully integrated one, taking knowledge and experience of all researchers into account, it's an asset, and it creates clear research objectives and a kind of holistic approach to collecting data, conducting analysis, and also disseminating results. I'm mentioning all this to again highlight that dissemination is not an add-on. It's not an appendix that comes at the end of the process. It's a mindset that you have from the beginning and from the outset, from the time that you launch your research. I want to share here a tool. You don't have to read it. There's a lot of slides here, so just focus, a lot of content here. Just focus on the red parts. This is an extract from a tool that we use as MSF called the Policy, Practice, and Engagement Assessment. After the assessment, we also create a strategy. So the assessment happens at the beginning, and it looks at all different elements. My presentation is focused on the dissemination, so that's what I'll focus on. But the assessment already at the beginning looks at what would this public dissemination look like, or what would even bilateral advocacy look like for this research, and how is that in line with the goals. And the point of the red highlighted stuff is to show you that this is not the job of one person. This is a holistic multidisciplinary tool. So you have at every single step different profiles working on it. You have medical teams, you have water sanitation experts, epidemiologists, advocacy specialists, field operation teams, as well as, of course, communication experts. Now, I tend to think that the burden tends to fall too much on communication experts, and many times they end up working in isolation from the rest of the team, because many times they don't speak the same, let's say, language. But when you're working on a research with a multidisciplinary team, you have to end up finding a way to speak the same language. This requires a lot of work as well from the communication person, because he needs to understand and fully have a sense of ownership of the research. But it's the same with the other stakeholders, be they medical, operational, epidemiologists, field workers, or even researchers. The sense of ownership needed for the outcomes of that research and the ownership of the dissemination strategy is something that is needed by all. It's not just the responsibility of the communication person to define and to disseminate and to take ownership of the potential risks and dilemmas. I think I would also like to, it was in one of the slides, but I didn't really focus on it. It's 1 second. Yeah, so it's this one. I don't think I said enough about this. Many times, and I heard it in the other presentations, we use words like informed consent and patient confidentiality, but those words are not just words, and they get really tested when we work on the dissemination strategy and when we put it out there. So how informed is informed consent, and how confidential is patient confidentiality? Many times we get that signature on the paper, but then we realize when we are working on the digital report and on distributing the findings that our patients and our stakeholders and our participants do not always understand the impact and the reach of digital tools, specifically digital tools. And there have been several cases where we had to recall, adjust, and even make serious changes to a report after it was out there because of a misstep on consent and confidentiality. But also because sometimes the fears of communities and the retaliation is not very clear in the beginning. And even the report can be out there, disseminated, shared, and then it can actually cause retaliation and danger and harmful impact for the community way after it was shared. So it doesn't just end, and this is where I will end. I know that there will be a Q&A, but I also wanted to put some powerful questions and considerations that maybe at first sight don't really look like they are about dissemination, but they really are. Because questions of dignity, decency, and responsibility, yes, these are questions that you think about when you are communicating on research and when you are disseminating research. How are you safeguarding against instrumentalization and manipulation? And how are you protecting the participants, the communities, and even the larger narrative? What is the conscious and unconscious ways your research is contributing to shaping narratives? And then platform. There have been some problematic examples, and I've seen many over the years, where a good research or a research that is in alignment with principles of dignity and ethics would be published on a bad platform. For example, one that, if we think of refugees, has hosted xenophobic or racist content. So then no matter what language you use to describe your research, your choice of platform is problematic. And it will raise issues, and it will again decredibilize or hurt the outcomes of the research that you have. So overall objectives and target audience defined at the start of the study impacts and affects every single decision and step, including the choice of platform. Issues of language and voice are key. Sometimes we talk about vulgarizing or simplifying language used for scientific research when it comes to public dissemination. But then how far is too far? How simple is too simple? And when does it obscure your research outcomes and results? And when should you put your foot down to say, you know, I know this concept or this word will not translate or will not speak to many, but due to my objectives, I cannot simplify this more. And other times it's a bit more the other extreme, where incredibly dense material is put out there on platforms and targeting audience that simply cannot connect with it. And actually that is also a way of doing harm, and it's not giving the research its proper platform or its proper wings to fly and to get where it needs to go. A couple of last points from me is impact and feedback. Many times we have a short-term cycle when we think of impact and feedback. We think of it as right after the research is published or within a small time frame afterwards. But actually, through dissemination and through monitoring dissemination and evaluating the impact of your dissemination, it can really open up exciting opportunities back to the research itself. It may lead to research questions that you haven't considered for a second round, or it may open up and influence even other research beyond your original scope. So monitoring and evaluating the impact of dissemination is not something you do after you prepare a report, or not you, but you know, a report is prepared with the citations of where this has been shared. But it's a process, and it lasts quite a while. Finally, bringing back to the first image that I shared, how do we see the role of participants and community? Are we seeing them as subjects, objects, or are they true participants and stakeholders? And I'll come back here to the image that I shared in the beginning with the Congolese researcher to highlight that we need at the outset to realize that we are not in a balanced world, and the research and its dissemination are occurring in a very unbalanced world, where research subjects and objects are not often seen as participants and stakeholders. Even, of course, if there's a certain limit of objectivity and a sense of distance that needs to take place, it's actually being questioned right now, specifically in conflict settings. You know, this critical distance is needed, but at the same time, not in a way that dehumanizes and objectifies research participants and communities. And where the research gets shared and how it gets shared, how it's packaged, how it's visualized, how it is digested for general audiences is definitely can contribute towards this dehumanization of patients, communities, and stakeholders. I'll be happy to answer some questions. I'm sorry about the challenges with my PowerPoint, and thank you for listening.
Thank you so much, Jihan. This was really a very nice presentation. I really like the sentence that about the report, that it really makes a difference between rhetoric and reality, and this is something that we always want to highlight, because this is what really research does. If there is no data, it's like it did not happen. So thank you so much for that. We will take any questions from the audience. You can put it in the Q&A or in the chat box. I think there's someone with a raised hand. No. Okay, so how can we monitor? I believe, Amal, do you mean dissemination? I think.
Thank you, Amal, for the question. I think you mean dissemination. We monitor dissemination through, I mean, there are tools. So you go back to the, if you've disseminated the research on social
I think
media.
Jihan,
Can you hear me?
you got cut off for a couple of seconds. Can you please repeat?
Sorry. Yes. So I was saying it depends on the package itself. So it depends on how you've decided to disseminate. So you monitor according to the platforms that you've used and to the in relation or in complementarity to the tools that you've used. So if you had a campaign online, for example, with some of the outcomes of the research, then you can monitor engagement and reach through the questions and answers that you get. And this requires sometimes extra resources, but it's really well worth it. There are surveys, post-diffusion or post-dissemination surveys that can be used as well sometimes that can give an indication. And then third, we are not that good at tracking beyond our own platforms. So a research can be taken up by a university or another outlet and another entity, and then we don't know how it has been used or what has happened to it. So one thing that you can do as well is bring on partners to the dissemination strategy. So if MSF is working with AUB on a research, AUB would be seen as a partner of the distribution or dissemination strategy, which would mean that it would be already clear how AUB is going to share and what they're going to do, and what MSF is going to share and what MSF is going to do. And in that way, you split the load. There are also tips and tricks, mostly linked to online diffusion, that can make things quite easy. It's not as overwhelming, but it requires resources and organization for sure.
Thank you so much, Jihan, for the answer and for the presentation. So we will move to the next presentation. It will be addressing common conflict-specific ethical dilemmas. It will be presented by Dr. Anik Antrians. Dr. Anik is a medical strategic advisor and the manager of the investigational platform for experimental Ebola products at MSF in Geneva, Switzerland. So Dr. Anik, the floor is yours. Just, I think there's one more question for Jihan, I think. So Jihan, how are the criteria of no harm being defined? What are the references? What is the process to define it in research world?
Okay, I think also, so where am I? Yeah, I think Anik will also touch a little bit on this, but when it comes to communication, we monitor for for example, the use of discriminatory language. We monitor for reprisals, attacks, and also, I mean, many times, we don't know if the publication of this research will improve the situation, okay? But we know for sure that if it is taken up negatively and if it is not perceived as or not communicated in a respectful way that protects the patients, it can lead to reprisals against them. So I'm thinking of sensitive topics, specifically as well in conflict-affected settings, such as sexual violence. For example, it can also lead to stigmatization of certain communities, sometimes through the diffusion and dissemination. So again, these are considerations that you will take when you choose the words, when you choose the images, and there is no such thing as too detailed. You know, a lot of discussions will take place. Sometimes one image can put an entire community at risk and can put an entire person at risk. So yeah, I hope that answers.
Absolutely. Thank you so much, Jihan. Dr. Anik, the virtual floor is yours.